So most of you guys know me. I'm Patrick, third-year resident, applying for Chief EM. Threw this up here just to kind of stand out from the crowd. But what I'll be talking about is first just a little bit of me, and then also just a few things I want to change in or work with the program. So that's me. Just in that last lecture, it seems like everyone thinks, oh, this guy's kind of Irish, or maybe he looks kind of Hispanic too. But you stand there and think about it, what the hell is this guy? Turns out, who is it? Cooley. He's like, oh, you're Filipino. I am. So I am as I'm as Asian as this bear riding a pony over here. What that means to anything that we're talking about, Asians typically are very good at using computers, so working with the projector, as well as even setting up the web page, updating it, all that fun stuff. So those are things that I'd be able to handle. So a little about me. Back in medical school, I spent 2 years as a physiology teaching assistant as well as a tutor, so I kind of have a little background experience in terms of teaching. These are some of my interests in terms of wilderness medicine, ultrasound, and teaching. So in terms of ultrasound, once Renee's gone, I may be one of the more read up and also hands-on after her. And in terms of teaching, it's one of my career goals. I want to work in a place where I can work with residents, work with medical students. So this would actually be a pretty good position for me. So I'm not going to play this because it'd be way too long, but Scott Weingart, we listened to this last year. It's good for interns and whatnot to listen to for motivation. But one thing that stands out in terms of everything he's talking about is, education. There's multiple parts of it, and what we have to do is try really submerge ourselves into the content. And the thing is with us, we're just so busy with clinical aspects. Educationally, I feel like we do a little bit better. One of the things he recommends is, just jump into the river, try and drink it, just push yourself as hard as possible. So the question is, how are we going to do this? So Dr. McFarland told us that intern year that, we're in the looking glass all the time in the ER, regardless if we're in residency or afterwards. People are just critiquing every single little decision that we have. One of my ideas is that, when I'm on off-service rotations, I find that, we miss stuff, we screw things up, and I think it's a good learning opportunity for all of us. So I think we could set up collaborations with different programs and just get insight in terms of things we could do better and present it either individually or on a more, during Wednesday lectures. So I think it'd be a good educational opportunity. In terms of our lectures, oftentimes we're off service or we're doing overnights and sometimes we don't come or we're just too tired to listen. Some things that we could do to fix that would be posting slides online or recording guest speakers. That way everyone has an equal opportunity to catch up when possible. Another thing I've read up on is that some programs have incentivized attendings to provide lectures, and then then they start working harder and they become more competitive and they give us better lectures. So additionally, Tintinelli's a great source. I recommend Robertson Hedges. I think that's something we could supplement in terms of, we really just have to be masters of the procedures that we're doing and know of every single complication. So the book just breaks everything down in terms of pathology and indications, contraindications, complications. So that's one thing we could tie in as a supplement. For these up here, for ACEP has about 19 clinical practice guidelines. That's just it's reviewed. There's like level 1, 2, 3, and evidence in there. And I think that's something that we could either go over during lectures or something that we go over during journal clubs, going over the literature. I throw Facebook on there just because whenever I'm reading something on foam, I always think wow, this would be really good for everyone in our residency to learn about. But you just can't really send out 40 emails a month and everyone's gonna just zone out. So I think if we throw it onto Facebook, Twitter, something you could just sit in the bathroom and just ponder some of that information on.
Very shifter.
Yeah, maybe we'll. What about our medical students? Medical students, they come over here ready to learn, going to see patients with us, and then sometimes we get so busy that they kind of, get put into the back burner. I think this is one thing that we could work on And ways that we could do that would be some programs have done pre and post tests for the students, individualized lectures, and what else? Oh, and also radiology. They have like 5-minute lectures that the students present in conference, so we can see their teaching ability. Another thing would be for skills and simulations. We could do that for students, even interns and seniors. Like this is our difficult airway mannequin that we have in our skills lab that we don't really use that much, but our interns don't do anesthesia. I think it's just something that we could really just hammer in on. Just we want to be the ones on the floor that's taking care of these things. And then even for seniors, you could, if you open this up, you could jerry-rig the whole thing to create like complicated intubation scenarios like massive hemoptysis and like main stem intubations and whatnot, or bleeding in the lungs. So lastly, I think we can revamp the call room. It could use some work. I've spent like the last 3 weeks in the ortho call room, and it puts us to shame. So I think we could get at least some resources in order to update this. And if anything, she wants me to be chief, so I'd her to make her happy. But yeah, so I think I'm very suited for this position, and we can make this residency into an incredible residency program for everyone. Thank you.